Assalamu alaikum. Welcome to another episode of our health show. Today we have with us again on our show Miss Nimtaz. Giga, she's a dietitian at Agha Ghan Hospital. Welcome to our show.
Thank you.
And thanking you for coming to our show again. Today our show is directed to our young mothers out there. Any questions that you have about during your pregnancy, about what kind of food to eat, how much to eat, what to avoid, all are going to be answered today. So if we start with our first question, what kind of food or what should a pregnant woman usually eat during her pregnancy?
Before that, I think the more important question is how much should a mother eat, because what has been noticed is that mothers tend to think that they need to eat for two, for themselves and for the baby. That's not true at all. So a mother only in the first trimester doesn't need anything extra. What she eats is sufficient. In the second trimester, she needs about 350 calories more, which only equals to about a sandwich more, like a tuna sandwich. And in the third trimester needs about 450 calories. And in terms of what to eat, basically you're eating a healthy, normal, balanced meal. And when I say that, I mean, they need starch, they need protein, they need fruits and vegetables, dairy, everything is important. They don't need anything special. But it is also important to note that they need slightly higher protein during pregnancy. But considering our diets in Tanzania, we already have slightly higher proteins than we need. So that's already covered. So unless you're vegetarian, I wouldn't be worried about that. It's important to maintain a good variety, although, especially in fruits and vegetables, so that you're managing all your vitamins and your minerals and all your essential nutrients from your diet.
So this is a very good information for our viewers, that they're not supposed to eat for two. Basically, not even during the first trimester. Basically, during the second and third trimester, that's when there should be a slight increment in their daily intake.
That's right.
So when you talk of fruits, there is a general myth around our community members that eating papaya increases the risk for miscarriages.
That there is no research supporting any such myths, right?
So it's any fruit, any vegetable.
Any fruit, any vegetable, unless your doctor has specifically stopped you from eating a fruit. And that would only happen when you have certain allergies or certain discomforts like heartburn, or which we'll talk about later, I think. So unless it's causing any discomfort, there's no fruit that can clinically cause harm to you.
Okay, so since now we have talked about what to eat and how much to eat, we ask another question now. What to avoid during pregnancy?
Okay. So one thing that you want to really be careful about is the food safety, right? So because you want to avoid any sorts of unnecessary infections, because that can lead to complications, right? And when I say food-related infections, I mean things that would be eaten raw, for example. When we make a steak and it's not completely cooked, it's half done. That can cause some harm to the mother and to the baby. Fruits or vegetables that are not washed properly, or fish that's eaten raw. Basically anything that could potentially have some sort of infectious cause that should be removed from the food to avoid to prevent basically any risks. Secondly, I would also say caffeine, because research is not very conclusive about caffeine in pregnant mothers, but we would rather be safe, right? So, and some research has shown that pregnant mothers drinking caffeine can cause the baby to be of low birth weight, so hence the baby not developing to the weight that the baby would ideally develop to.
So when you talk of caffeine intake, do you mean that the normal morning tea that a woman takes should be avoided as well, or probably in excess?
I mean in excess.
In excess, what's the cutoff point?
So about 300 milligrams is what a mother can take in a day.
That's how many cups of tea?
It's about 6 small cups of tea, which is
quite normal.
Which is still a lot. I would not. That is the recommended amount, but I would still not go for 6. I would rather have 2 or 3 small cups a day, because, like I said, prevention is always better. So I don't think caffeine is something that can't be avoided.
Okay,
So,
because basically people usually take 2 cups of tea, so...
exactly, but caffeine also comes from lots of other sources, so we need to remember that. Coffee,
Right.
tea, chocolates, energy bars, energy drinks. So we need to, Coke is a big one. So we need to be careful and cautious of the other food sources also. So it's, I mean, it can equal to 6 cups of tea, but if you're having 6 cups of tea and then you're having coffee and then you're having an
means it's
energy
already
bar,
in excess
you've
now.
gone way beyond. So the 6 cups of tea is really only an indication of how much 300 milligrams reflects on, but our diets have much more caffeine than we realize.
Another thing that I wanted to ask you that, you know, some say that taking of fish is very healthy during pregnancy because it has high source of protein. But on the other hand, they say excess fish intake is even toxic. So how would you explain about that?
So what I said about the reasons for, like, you know, toxic or infectious causes, you know.
It's only infectious, or is there any kind of constituent of fish that mainly causes toxicity?
Do you know this whole thing about fish having been contaminated with mercury and all that vibe that's coming up now? That is what is scaring people, and it is true that can be harmful to the pregnant mothers. But again, that is all research that is inconclusive. So I wouldn't say remove fish completely from your diet, but don't overdo it either.
So how many portions or how many times a week probably can they take?
I think once or twice a week in a good portion is okay to have.
Okay. Now because in pregnancy, basically a woman feels more hungry, she might eat a lot, but you know, at the same time she has to watch her weight, right? So how much is safe weight gain during pregnancy?
So that depends on a lot of factors. It's not just, I can't just look at you, a pregnant mother, and say you can gain 10 kilograms. First of all, it is individualized, right? So every mother, it will have a different safe weight gain. That's the amount of weight that safely she can gain without causing any harm. It depends on what you weighed before. So your body mass index, your weight as per your height before pregnancy, depends on what you weigh now. It depends on your lifestyle, whether you exercise. So a lot of factors influence how much you can safely gain. And the less you were before pregnancy, the more amount of weight you can gain safely. But for a normal individual, like someone like your or my own size, can gain about 12 to 15 kilograms safely. Someone who was overweight before pregnancy would only be able to gain about, let's say, 8 to 10 kilograms, not more. So it really depends on factors that, you know, or that you had before pregnancy.
So basically it depends on every individual. What was your weight previously,
exactly.
And then how much you can gain safely.
Yes.
So if at all the woman gains too much weight, like because every woman goes for antenatal clinic where they monitor the weight.
Yeah.
So if the weight gain is excessive, what are the consequences that the pregnant woman can face?
I mean, think about the delivery, okay? First of all, during pregnancy, you can develop complications because there is risks of developing diabetes and, you know, high blood pressure. So that risk does increase. Secondly, think about the process of delivery, how difficult it will be to deliver that baby if you're overweight. Finally, think about the weight that you've put on now post-delivery. You have just delivered a baby. How are you going to lose all that weight? It's not normal to be able to lose so much weight just without doing anything. Normal processes do kick in, and hormones will try to, you know, tie up and make you lose weight, but not that much weight. So you're just basically accumulating so much fat and, you know, unnecessary weight to deal with later on, which is completely not, you know, advisable.
This is a very important information for our viewers about the weight gain, the normal weight gain. So another important thing, you know, like every day we take our normal diet, but during pregnancy, there are certain nutrients that have to be taken, yeah, higher than the normal proportion, such as iron. So what exactly is the role of iron in pregnancy?
So iron plays a big role in brain development. It plays a role in your immune system. It forms part of your blood cells that are important for transport of oxygen. And so if you don't get that in the right amount, think about what could happen. So if it's involved in the brain development, your child could suffer in the future with performance in school, right? If your child's immune system didn't get developed properly, fighting infections will be a mission in the future. Blood cells, if there's not enough blood cells developed, that will affect your transport of oxygen. So there's a lot of consequences of not having enough of this.
What kind of food sources should the pregnant woman increase its intake to get more iron?
So iron is found in all your meat, so your meat, fish, chicken, also in nuts like the cashews, almonds, green leafy vegetables like spinach, like broccoli. These are all very high in iron. And finally, you could also have fortified products. Fortified products are basically, let's say, flour that has been added some iron. I'm not sure how much is available here, but reading labels would help to know what products contain more iron. But remember, this is something that also you don't want to go over iron. So you want to follow your doctor's recommendations on what is recommended by your doctor, because if you go over, there's also a risk of toxicity.
Okay, so basically the thing is that the woman should make sure that she takes all these things in her diet, not necessarily that she has to increase the intake of all these things to such an amount that it causes toxicity.
Exactly.
During antenatal clinic, the pregnant women are usually given ferrous sulfate. Like now we call it as FeFo. That's given in combination. So is there any need of taking those iron supplements?
If your doctor is recommending your supplement, your iron supplement, then yes, definitely there is a need. He must have done a test, he must have checked your hemoglobin, and that's when your doctor will recommend. So if your doctor has recommended, it is highly advisable to follow those recommendations, because like we said, the consequences of not having enough iron are huge. So we don't want that. So if your doctor is recommending, it is based on a test, so you should definitely have those supplements.
Another question that young mothers might be having is when to start taking these iron supplements. Like, is it before conceiving, during the early months of pregnancy, in the first trimester, or later on when the demand of iron is increased? When is it crucial for them to take iron?
I think that's a very individual-based question. That again, your doctor would have to determine, because if we just blanketly supplement everyone, all pregnant mothers, with lots of iron, we may run a risk of overdoing it. So as per your doctor's recommendation, whenever your doctor has recommended you do have to take advice on how long you're supposed to take these supplements for. So that would really depend on recommendations from your doctor.
Another important supplement that pregnant women usually get, the folic acid. Sometimes they're told that they should eat more fruits, or sometimes they're given tablets or in combination with iron tablets.
Yeah.
What is the role of that folate in pregnancy?
Folic acid is very, very important in brain development and in nerve development. So this one is where if you don't get enough folate, your brain can actually not develop. It's not like iron where there will be consequences later on. In this case, if you don't get enough folate, the brain will actually not, there is a chance of brain not developing or not developing in the right place. So the risk is huge of not having enough folic acid. At the same time, it's involved in nerves also. It can cause problems in muscle development, which can further cause problems in movement, can lead to your internal organs not being fully developed. So that the risk is quite huge of not having enough folic acid.
So when is the most crucial time to take this folic acid? Because the way you say that it's important while the woman is pregnant for the development of the brain and everything. So is it before she conceives, or is it during the first trimester? Because the first trimester is when all the organs start developing. So is it only then or later during pregnancy?
The most crucial phase is between 3 to 5 weeks, and your doctor should tell you that, because that is the time when your brain is at its peak of development. So that is the most crucial time. However, when you're planning a pregnancy these days, a lot of doctors will recommend you, when you're just planning to fall pregnant, a lot of doctors will tell you to start taking folic acid supplements before conception. So the question, to answer the question, is it's earlier on in the pregnancy is
So
when it's most
the
important.
better.
Yes.
Okay. And are there any food sources that pregnant woman should take to be like in a continuous supply of folic acid?
Yes, so like what I said about the meat, fish,
The
chicken,
same
the
thing.
same thing applies here too. But in this case, also whole grain products would have quite a lot of folic acid. Liver is an extremely good source of folic acid. And so is dried beans and lentils. So all their pulses, you know, the dal and the beans and all that. Those are also good sources.
And then we come to another question, another problem that many pregnant women go through, discomforts. So such as heartburn, which usually they complain of during the later months of pregnancy, such as the late second or the third trimester. How does heartburn actually happen?
So heartburn, think about the baby growing inside your belly now, you know, so it's pushing on the stomach. And when it pushes on the stomach, it's sort of pushing on the opening of the stomach, which is responsible for blocking the food from going backwards, right? And there's also a hormone release of progesterone, which causes the muscles that block that pathway to prevent food from going backwards. It makes it loose, so it makes it stay more open for longer. So that causes the food to, first of all, it's the pressure, and now this muscle is also not holding it strongly. So the food can easily go backwards. So you've eaten your food, it goes to the stomach, and it can't just stay there now. There's a lot of times where it goes backwards, along with the acid that the stomach has produced. Hence, it gives you the burny feeling.
So that means the heartburn is normal to occur because of the baby growing and because of the hormones.
Absolutely, yeah.
Are there any tips that the pregnant woman can use to prevent or maybe to reduce the heartburn?
There is definitely tips to reduce the symptoms, right? So one can but it is again a very individualized thing. So something that would affect you would not necessarily affect someone else, right? So they need to find out what gives them the heartburn. So there are foods like acidic foods, fatty foods, spicy foods that can potentially give you that heartburn, even in normal individuals, right? Even someone who's non-pregnant. So these foods you need to watch out for, but that doesn't mean you stop eating, right? You need to discover what's affecting you and accordingly avoid that. What the other thing you can do is you can have small frequent meals rather than having 3 large meals, right? Because the more you fill up your stomach, the more acid you produce, the more risk of food going backwards. So if you have smaller meals, less acid is produced in the stomach, and the stomach can actually hold that and it digests more easily. Something else you can do is to prevent drinking while eating. That will also prevent risks of heartburn. Finally, I think you can also prevent lying down straight after eating, so that would prevent your chances of food going backwards. If you allow food to stay down by sitting in an upright position till it's moved further down, that would also definitely help.
What kind of foods specifically should they avoid, generally?
Like I said, it's very individual. So in terms of spicy foods,
actually causes heartburn before pregnancy.
Yeah, so when I say acidic foods, like citrus fruits, for example, would be
like oranges.
Like oranges or tomatoes would also be quite acidic. Those are, so one needs to discover what's affecting them individually.
What about if a woman has got heartburn? What about drinking a cold glass of milk? Would that help?
Not really. That is not scientifically proven. I mean,
because basically that's what people do whenever they have a heartburn. They have a cold glass of milk. So that wouldn't really help.
Scientifically, that doesn't hold any value. But if it's helping someone to relieve symptoms, then why not? Pregnant women need to drink milk anyway, so it would be fine. If it's helping you, it's fine. But scientifically, I don't think that's proven.
Another discomfort that the pregnant women go through, the morning sickness, the feeling of being nauseated every time they wake up. Why does it occur?
That's generally just a symptom. There is no explanation. I mean, most women get that in the earlier phase of pregnancy. And all you can do is really just manage the symptoms, like I said, and prevent not gaining enough calories, because some women tend to vomit so much that eventually they're not getting enough calories for themselves or the baby. So that's a general symptom. As long as it's manageable, it's fine. If you feel at any point that it's too much and that nothing is staying down, then you definitely need to see someone. doctor or dietitian to assess whether what you are keeping down is enough, whether your baby is growing enough, whether you are gaining enough weight, to be sure that this vomiting is not on the extreme.
So that means it's generally a normal thing for every woman to go through the morning sickness or nausea. So are there any tips on managing the morning sickness?
Again, nausea or vomiting it's individual, so avoid foods that would potentially make you nauseous. So everybody needs to discover what is making them nauseous, right? So in many cases we have noticed fatty foods can make you feel quite sick. So that is something you can avoid. But again, it's not like it will be the same for you and the next person who's pregnant, you see. So that is one tip. What else you can do is dried starch like toast or whole wheat crackers. These tend to help with the nausea, so you can also do that. And also small frequent meals, again, like the heartburn. I think in pregnancy generally small frequent meals are more acceptable for your system than 3 large meals.
Okay. And the third problem, constipation. Why does that occur?
So that's again the hormone progesterone, which makes our muscles relax a bit too much, right? So all your digestive, the whole of your gut is too relaxed, and hence doesn't allow squeezing the stool down in an efficient manner. So that's basically what keeps the stool not regular.
And any tips on managing constipation?
Yeah, I mean, drink lots of water. Water helps to help to push down the stool. Lots of fiber from whole wheat products, from fruits and vegetables, from lentils like beans, dal. We have lots of pulses available here. That would also help. And exercise, definitely exercise helps a lot with constipation. So walking, swimming, whatever works for you would actually help with this discomfort.
Because a pregnant woman would be quite worried about exercising or swimming at that point.
It's safe for you to exercise as long as there is no complications. If you're bleeding, then obviously, and if you've been put on bed rest, then obviously you cannot exercise unless your doctor has told you can. But for a normal pregnant woman, exercising is actually very healthy.
Okay, so basically the discomforts or the problems we discussed are basically the normal problems that every pregnant woman goes through, right?
Yes.
So the only tips that you can use to manage them, but you can't avoid them.
No.
Another major problems that pregnant women usually go through, like diabetes mellitus in pregnancy, like scientifically called gestational diabetes mellitus.
Yes.
Like just in a single sentence, how would you define it?
So it's basically this hormone again, progesterone, blocking the action of insulin, which is responsible for managing your blood glucose. So because it's blocking insulin, your blood glucose tends to go higher, right? And in some women, it can be a problem, and that's what we call gestational diabetes, when your insulin becomes insufficient to manage your blood glucose. So that's basically what it is, and it will give you symptoms similar to diabetes. Frequent
but it only
urination.
occurs during pregnancy.
Yes, that's right.
As a result of the hormone progesterone.
Yes.
So how would you manage a patient who has got gestational diabetes mellitus?
It would be important to see the patient specifically, because we can't generally manage this condition. It has to be specific management. But basically what we would try to do is manage the blood glucose levels through eating right, so proper dietary management, and we would highly recommend exercise. So let's say in a pregnant woman, if a person is normally diabetic, then it's just dietary management, right? But if a person is pregnant and has got this pregnancy diabetes, then we'd have to manage the blood glucose. At the same time, make sure the baby is getting all the nutrients that the baby needs to grow.
But then how would that be possible? Because if a person is managing all that, at the same time the person has to, like the mother has to take care that the baby gets enough. So what kind of foods, or how do you manage that? Like what kind of food is a woman supposed to take during pregnancy if at all she has contracted diabetes?
It's basically manipulating the rate at which your glucose enters the blood. So sometimes we would cut down break down the meals into many meals in the day, so that the insulin becomes sufficient for the glucose that goes into the system. We try to slow down the glucose release by giving you high fiber foods, so that you're not getting that high release of glucose which your body cannot manage because of the insufficient glucose. So there are ways, and we would definitely include your milk and your fruits and all that you need within this range. We would distribute it well for you so that you can manage the diabetes, at the same time not compromise on the calories.
So the main thing over here is to eat everything because the baby needs it to grow. And at the same time to eat it in small meals so that the blood glucose doesn't rise to a very high level.
Yes,
right?
but
That's
also not everything. I wouldn't say everything, because
then
sugars,
what exactly would you avoid at that time?
Sugars, definitely. You would avoid direct sugars like juice, soda, or any sweet dishes, because that is a lot of sugar at once. So those kind of things you would have to avoid. You might also have to avoid unhealthy fats and salt to avoid other complications, like getting your blood pressure high. Because once you have this gestational diabetes, there is a risk that you may now develop high blood pressure, pregnancy related. So these three foods would be something that you would definitely have to avoid: salt, fat, and sugars.
Okay. Another major problem in pregnancy, the pregnancy-induced hypertension, as in the high blood pressure during pregnancy. In one sentence, would you define it in terms of preeclampsia and eclampsia, the scientific terms for hypertension in pregnancy?
So preeclampsia is basically when you have a high blood pressure related to pregnancy. There is some protein in your urine, and then there is also it's also associated with a rapid weight gain because of the imbalance that it causes in the body. So that's basically preeclampsia. And the next eclampsia is what leads from preeclampsia, but which is like seizures that are not related to that don't really have a cause besides this. It's like pregnancy, almost you can say pregnancy related kind, yeah.
So how would you manage a patient who has got hypertension in pregnancy, especially preeclampsia, before developing into eclampsia?
It would basically be managing the high blood pressure. So it would be awareness on the salt intake of the person. So people think that eating the table salt is the only source of salt in your diet, but that's not true. So making aware on what else contributes to salt, like your dried products, like dried spaghetti or dried or sauces like tomato sauce, which have a lot of sodium, which would affect your blood pressure. So it would basically be managing like a high blood pressure patient, but also again making sure that you are getting all the calories you need for your baby.
Moving on from pregnant women to lactating mothers, the normal questions that a lactating mother would have, such as what kind of foods to eat, what kind of foods to avoid, maybe eating a lot could maybe enhance milk production. So we're going to answer all these questions in a bit. The first question, what should a lactating mother usually eat, like increase?
Again, it's not eating for two. It's never the case. Eating for two is never the case. It's never true that you need to eat for two if you're pregnant or if you're lactating, right? In lactation, you need a little more than what you needed in your pregnancy, so it's about 500 calories. And if you think about it, 500 calories equals to one sandwich, a glass of milk, and a fruit. That's already extra 500 calories. So you don't need to eat more. I mean, your normal diet plus the extra 500, that's sufficient, right? So, and in terms of what a mother needs to eat, again, a healthy, balanced diet. It's not true that certain foods can enhance milk production. Milk production really, so how it works is there's a hormone called prolactin. When a baby sucks on the mother's breast, that prolactin hormone is stimulated. Stimulation of this hormone tells the body to now start producing more milk in the alveoli, and that's how basically milk is produced. So basically, the more times your baby will feed, the more times this hormone will be stimulated and the more milk will be produced. So it does not depend on what you ate. It does depend, however, on how often your baby feeds. Right, so that's because that will determine how much your baby needs, right? And your body is already made in such a way that it will produce exactly what your baby needs. So that is under control. There is no food. I know there's a lot of traditions that say if you eat this,
like porridge or uji.
These foods do help with letting down the milk. There's a difference in milk production, and then there's a letdown reflex whereby the milk actually comes out, right? So warm drinks like uji and milk do help somehow, but not in producing milk, in just letting down. But the traditions on where they say asli ghee and certain foods will make you get more milk, those are not scientifically proven. I know these are things that we do because these are our traditional things, but it's not something that is scientifically true.
So the body itself is being made in such a way that it can cater for the baby's needs.
Exactly.
Right? The more the baby needs, the more the body produces.
Absolutely, yes.
Okay. In pregnancy, in during lactation, you would usually advise a lactating mother to eat healthy and balanced meals. So how would you advise on those kind of meals?
So healthy and balanced again goes back to our question of pregnancy. What is a healthy and balanced meal? Something that has variety, a meal that has a variety in food, so all includes all your fruits, all your vegetables, different kinds of starches. You do need, however, a good amount of starch in all your meals. You do need enough protein in your diet. You need fruits and vegetables. And the foods again that you would want to avoid is your unhealthy fats, like the saturated fats, like fat on the meat, the nundu and all that. And you would want to avoid salt and high sugary foods, especially for the mothers who develop gestational diabetes. Because post-delivery, you want to make sure that this problem is now disappearing. But if you are not managing your glucose levels or your fat intake or salt intake too well, you may actually carry on the problem into your normal life, which is not very good, because that becomes a lifetime problem then.
Okay. Since I've already talked about how much should a lactating mother eat, what kind of food to eat, now we go to another important question. What kind of foods should lactating mothers avoid?
Okay, definitely caffeine. Caffeine is something that babies cannot break down easily, so that can cause a lot of problems to the baby because it does pass down the milk. Secondly, caffeine can also make your baby stay awake, be irritable, fussy. So it's not saying that you cannot have any. You can have some, but you have to see how your baby is taking it, right? So if your baby, you see, is like if you're having a cup of coffee in the evening and your baby is staying up at night, you should try to monitor whether that is the cause. If it's affecting your baby, then you should have it in very minimal amounts and avoid it before feeding times.
Okay. When you say avoid it before feeding times, like if a mother, like she maybe needs 1 cup of coffee a day to stay awake, but at the same time she realizes that, okay, it is affecting my baby. So how should she be careful? Like how many hours before the baby's feeding time should she take coffee?
Well, the baby will feed almost every 3 hours, so probably following a feeding time, she can just have her coffee so that she gets 3 hours between the next feed to sort of try and get it out of the system, which is not really, I don't think it can get out so quickly, but I mean, you just have to play around with time and see how much. Secondly, I would also say alcohol is completely not recommended. The thing is that it has not been proven whether how much alcohol is going into the breast milk and it's affecting the baby, but there is some research showing that it can affect the baby's brain development. The baby may stop drinking the milk if the baby gets the smell, and it may also affect your milk flow, so your letdown reflex. So alcohol definitely has consequences. Research just needs to show how bad the consequences, but in the meantime, I think we need to be very cautious in drinking alcohol during feeding your baby.
Even lactating mothers need to be careful about certain medications, even the normal medications that they take. What kind of medications or how do they affect the babies?
There are some medications that go through the breast milk and there's some that don't. Your doctor would be able to determine that, and I think there are some mothers who would be like on a chronic medication, let's say for thyroid or something. So the doctor would have to assess whether the mother going off the medication is more beneficial, or the mother continuing to feed and continuing on her medication. You have to basically weigh out the advantage and disadvantage of if the medication is going through breast milk, you have to weigh out what is more beneficial, stopping or keeping on the medication.
Okay. Just briefly, would you advise our young mothers the advantages of breastfeeding?
Breastfeeding is a complete source of nutrients. I mean, it's got everything a baby needs. For the first 6 months, the baby doesn't need anything else. It has got enough amount of water, so the baby doesn't need any extra water. You know how sometimes we think baby needs water? What actually we do by giving the baby water is that we fill up the stomach space, right? And then the first 6 months, we are only relying on breast milk, ideally, right? So if you fill up that little space with water, then that's taken up a little space of the breast milk, hence not giving the baby enough. And that may cause a problem with the baby's growth. So it is advisable to only give breast milk because it's got everything, the protein, the fat, the vitamins, the minerals. It's complete. It's got a complete source of nutrients. Secondly, it's hygienic. I mean, how easy it is to, you know, to keep that a clean process, because as soon as you introduce a bottle, there's a risk of infection. Maybe you didn't boil the bottle well, or you touched the bottle with your hands that weren't washed. There is already an infection source, you know. On the other hand, breast milk doesn't need any cleaning. All you need to do is you have your baby with you, you're there, you're relaxed, and you're feeding the baby. So it's hygienic, clean, it's safe, and it's easy. Immune boosters from the breast milk. The baby's immunity gets extremely strong if the mother is breastfeeding, because it provides all the immune factors that a baby needs. So fighting infections becomes so easy, you know, for the baby. So baby actually stays healthy. Easily digestible. Breast milk is something that's made for the baby's underdeveloped gut, because your digestive system is still developing, right? And if you introduce things that are not digestible by the baby, you are affecting the gut. On the other hand, breast milk is exactly made for that weak system. So it's easily digestible. It doesn't have any problems. And you will notice that when we give formula milks, a lot of times babies get diarrhea or get constipated, and that shows that the baby is not digesting the milk very well.
Because the breast milk is ideal, especially made for the baby.
Absolutely.
Containing everything in its adequate amount.
Exactly. Also, think about the bonding that the mother and the baby go through in that process. I mean, it is a very close process. So it's a lot. Baby feels loved and cared for. So it is definitely beneficial for the baby. If you think about the mother also has advantages, because it helps with the bleeding post-delivery. It helps with losing weight. It's easy for them. It's easy to manage, unless they're going back to work. Then you have to think about expressing. If the mother is staying home, then it's the easiest thing the mother can do in terms of feeding the baby.
Now we go to this very interesting part of our show. There's certain myths that are believed by our society. I want you to explain why it is true or why it is not true.
Sure.
Yeah. The first thing, that pregnant women only crave for the foods that their bodies need.
That is not true, because the cravings are a normal part. It's a normal part of your pregnancy, right? So the cravings are sometimes so, I mean, if you think about it, sometimes women crave for ice, and sometimes women crave for, you know, dongo and sand.
There's the pica that
the
they call
pica,
it.
exactly. So it's not true. It's not true. The cravings are a normal part of the pregnancy. There is no direct relation of the body knowing what it needs in order to crave for that particular nutrient. So that's not true. That's just the way people have started thinking about, but it's not true.
Another myth, a pregnant woman who is healthy will not experience any discomforts.
I wish that was true. Unfortunately, that's not true, because, I mean, as I explained, the discomforts are caused by the hormonal changes, most of them at least, like constipation, heartburn. So the discomforts will be there because of the hormonal changes. However, if you are healthy, if you're eating healthy, if you are a normal weight, you will reduce these discomforts, because if you're eating less fatty foods, like I mentioned in a lot of categories, that fatty foods will give you heartburn, or fatty foods can give you nausea. So
sickness.
Exactly. So if you're already avoiding those, then definitely you are in a better place. If you're healthy, the discomforts can be reduced. Unfortunately, cannot be eliminated from the woman.
The third myth, that the yellow milk in the beginning that usually comes out should be thrown out. It's not healthy for the baby.
So the yellowish, yes, the yellowish milk, which is called colostrum, it's not supposed to be thrown out. It is very healthy for the baby, because it's got all the immune factors it's baby's first immunity. So you don't want to throw that out, because that is what will protect your baby from infections. Also, that the amount of yellow milk that comes out is made for the size of the baby's stomach, because the baby has just come out. The stomach is very small, it's tiny, it's not going to be able to manage a lot. That amount of milk is exactly made for the baby's stomach in that initial phase. So it's perfect. God has made it in its natural way. So it shouldn't be thrown out, it should definitely be given to the baby.
Now that we're approaching our end of our show, Ms. Nimtaz, is there any advice that you would like to give our viewers?
Definitely, it is very important to be aware of what to eat, how much to eat, because a lot of women are harming themselves by gaining too much weight during pregnancy, or by doing all these extra things post pregnancy. It's important to be aware, to be educated about these things. And at the Agha Khan Hospital now, we are in the process of developing an antenatal care booklet, which will be given to all new mothers. So please do take advantage of such information sources, because this is your way of knowing what to do and what not to do. And follow the advice, because times have changed, and being fat during pregnancy is not good anymore. Before, it used to seem like it's a good pregnancy, but nowadays it's actually unhealthy for you. So be cautious, be careful, and enjoy the pregnancy and the taking care of the baby after that.
Thank you so much, Ms. Nimtaz, for coming to our show. Thank you, viewers, for watching. Khuda Hafiz.